Hey guys, it's Steven here. I wanted to go over a quick question that I've been getting a lot of over the last few weeks. And I titled this Mattress Wars because what I'm getting is a lot of questions about how do I choose the best mattress for my back pain. And it's a common question, and mattresses get a lot of attention. So I wanted to go over that a little bit because there's this kind of new generation of mattresses coming out, mattress companies coming out, that's a lot different from when I was in school back in the 90s. So first I want to talk about a professor from Harvard. His name is Dr. Jeffrey Katz, and he's been doing research on sleeping, and try multiple mattresses so that you can see what's the best fit for you, because the reality is there's not a good mattress, one perfect mattress for everyone. So now I will say this, the studies that he's come out with and most recently say there were 313 patients that were suffering with low back pain, and the conclusion of the study suggested that there were more patients, that patients responded better or had less pain when they were sleeping on a medium firm mattress compared to a firm mattress. There was less improvements. Now when I was in school, that was kind of the opposite. We were taught the firmer mattress was best for the pain, but what we're now seeing is a little shift in that. So with this Dr. Katz's recommendation to try multiple mattresses, you know, back in the day we'd have to go to the mattress shop and lay around for hours on different mattresses, and now what we can do is we can order these mattresses online. We can have them sent to us, and most companies are letting people sample them for anywhere from 2 weeks up to several months. So with that said, I want to go over a little bit of the new mattress firms or mattress brands that are out there that I don't know much about. This is new. I'm learning this from my clients, and I'm wanting to get a little bit of a better handle on it. So these are the new generation brands, and they are Saatva, S-A-A-T-V-A, the Helix mattress, Amerisleep, and the Bear mattress. And each of those four brands range from $800 to $1,200 for a mattress. And again, they're online shops, so you can order them online, and you can send them back if things don't go according to plan for little money or no money. So again, I haven't tried any of these. So now I'm going to talk a little bit about the ones I've tried. I've had a Sleep Number bed, also known as Select Comfort. I loved that bed because it allowed me to set the tone, the firmness a little firmer, and it allowed my wife Cheryl to set the firmness a little softer. Now, we loved it. I loved it. My wife Cheryl hated it when we were 8.5 months pregnant, and all of a sudden it broke. And the customer service from the Sleep Number people, when it came to fixing the bed, because it was a pump, we were now dealing with a mechanical issue, they weren't very good with fixing it, and Cheryl was not too happy with that company. So we then moved on to a Tempur-Pedic, and I now have a Tempur-Pedic Breeze, which is the one that's supposed to not be so hot, and that one's been fine. It's a little softer than I like, but it has been a very good thing for us. The difference is we're looking at $2,000 to $5,000 for these mattresses. So the new generation brands, again, $800 to $1,200. These are queens I'm talking about. And for the Sleep Number, the Tempur-Pedic, we're looking at anywhere from $2,000 to $5,000. So that's it on the little bit of a question of what mattress do I choose and why. So take that information. If you have any comments, if you have any questions, type them in the comments below, and I'll certainly get back to you, whether it's now or later. And if you have any further questions and you want to reach out to us, you can reach us at 512-215-4227, or our website is www.therapyandpilates.com. And the "and" is spelled out A-N-D. And that's it for the day, guys. And I'll be back in a few days with some questions on sleep positions next. Your side, your stomach, your back, etc. All right, I hope all is well. Y'all take care, and I'll talk to y'all soon.